Hi, hello everyone. Welcome to Farre Series. Am I audible? Am I audible and visible properly? Audio video, is it clear? Okay. So we are discussing one very important topic, that is thanatology. Thanatology. Okay. Fine. So let's discuss some important main questions, short essays, and some important short answer that can be asked in your prof exam. That is from thanatology. See, what is thanatology? Thanatology is study of death in detail, right? The Thanatos is the Greek god of death. So they can ask questions like classify post-mortem changes, explain in detail about rigor mortis, post-mortem staining, algar mortis, decomposition, putrefaction, adipose formation, mummification. All these are very commonly asked in your exam. So let's start with the first question, the one very commonly asked main question like this. Explain mechanism, order of appearance, causes of early onset and late onset, and medico-legal importance of rigor mortis. Rigor mortis. One very important topic in your prof exam. Rigor mortis. What is the mechanism? Order of appearance? What are the causes of early onset and late onset? And what is the medico-legal importance? You know, medico-legal importance is very important in forensic medicine. Any question asked, you need to write medico-legal importance. Okay. Okay. So what is rigor mortis? Anybody? Let's make it interactive. What do you mean by rigor mortis? Let's see who is going to answer. Rigor mortis. Mortis means after death. Rigor means stiffening. Okay. Yes. Good evening, Arshad Sham. Can you answer what is rigor mortis, Arshad Sham? What is rigor mortis? You know, there are multiple terms. Rigor mortis, algar mortis. Algar mortis means post-mortem cooling. Post-mortem staining, that is known as liver mortis. Gateways of death, that is known as atria mortis. So anything that can be asked in your exam. Okay. So muscles are stiff. Very good, Surya. Surya, very good answer. He answered, sir, rigor mortis is muscles are stiff. Fine. So in exam, when this question asked, you can see here the marks. So 2, 3 plus 1 plus 4 it is. Okay. So they can divide this into multiple categories in your exam. So sometimes they can ask you define rigor mortis also. What is the mechanism of rigor mortis? What is the Nysten rule? What is rule of 12? Or what is Shapiro rule? Anything that can be asked in your exam. Yes. So post-mortem rigidity. Very good. So R he answered, sir, post-mortem rigidity. Very good. So rigor mortis means post-mortem rigidity. Post-mortem rigidity. Okay. Anybody? What do you mean by cataleptic rigidity? Can you answer this question? Cataleptic rigidity. Anybody? Cataleptic rigidity can be asked in your exam. Cataleptic rigidity. 3 marks question. Sometime this can be asked. Anybody? Is it rigor mortis? Or it is something else? Or it is a differential diagnosis of rigor mortis? Anyone? Anyone? Surya, Arshad, Sharma, or What do you mean by cataleptic rigidity? Cataleptic rigidity. You said post-mortem rigidity, that is rigor mortis. My question is, what is cataleptic rigidity? So your answer should be cadaveric spasm. Okay. Cadaveric spasm is known as cataleptic rigidity. Cadaveric spasm. Cadaveric spasm. Okay. Yes. Now we are going to start with the definition. What is rigor mortis? So this is the definition taken from the standard textbook. Rigor mortis is early post-mortem change characterized by shortening and stiffening of muscles after death that follows the period of primary flaccidity. You need to write like this. Rigor mortis is an early post-mortem change. You know, post-mortem changes are classified into early, immediate, late post-mortem changes. Okay, immediate, early and late. So post-mortem changes, the changes that occur after death. So they are classified into immediate post-mortem changes, early post-mortem changes and late post-mortem changes. Rigor mortis is a early post-mortem change, that is because of molecular death or it is cellular death. Cellular death. So try to understand the definition, guys. So early post-mortem change is because of what? Cellular death. Cellular death. So what happens after death? Cells are going to die because of lack of ATP, because of lack of cellular respiration. Cells are going to die. So early post-mortem changes are because of the depletion of ATP or lack of ATP. They are going to lyse. Characterized by shortening and stiffening. Shortening and stiffening. Shortening, some degree of shortening and some degree of stiffening of the muscles. So muscles in the contracted state. So muscles, remember muscles, voluntary muscle or involuntary muscle? Anybody can answer? Okay, so that we'll discuss later, Surya. What are the differences between rigor mortis and cataleptic rigidity? We are discussing at the end. So my question is, rigor mortis, does it occur in voluntary muscle or involuntary muscle? Can anyone answer? Voluntary muscle or involuntary muscle? You know, eyelids are voluntary muscle, heart is an involuntary muscle, hai na? Smooth muscles are involuntary muscle. My question, rigor mortis, does it occur only in voluntary muscle or in both voluntary and involuntary muscle? Yes, Surya answers are voluntary muscle. So it occurs in both voluntary and involuntary muscle. Okay, remember it occurs in both voluntary as well as involuntary muscle. So try to understand, cadaveric spasm occur only in the voluntary muscle, but this rigor mortis occurs in all the muscles. Cardiac muscle, smooth muscle or skeletal muscle, all the muscles, they undergo shortening and stiffening after death. That is known as rigor mortis. Okay, so involuntary, voluntary, both. Okay, both it is. So that follows the period of primary flaccidity. You know, flaccidity means relaxation. So once person dies, when once human being or any person or any animal dies, all the muscle, they undergo relaxation. So in the beginning, say example, say 5 minutes or half an hour, all the muscles, they undergo relaxation. Once relaxation is over, they undergo the next step, that is known as rigor mortis. So you need to write this definition, guys. Rigor mortis is the early postmortem change characterized by shortening and stiffening of muscles after death that follows the period of primary flaccidity. This should be your definition in your exam. Okay, this should be your definition. This is how we need to define. And remember, rigor mortis because of what? Cellular death. It is an early postmortem change. It is not an immediate postmortem change. It is not a late postmortem change. It is an early postmortem change. It occurs in all the muscles, voluntary and involuntary muscles, after the period of primary flaccidity. So try to understand this. So all of you have understood the definition? Have you understood the definition, guys? Definition, have you understood? Say yes in the group, yes in the chat box. Okay, yes, fine. Thank you, Surya and R. So next is the mechanism. So next heading is the mechanism. What is the mechanism? Mechanism. So the mechanism, the one word answer, it is because of ATP depletion. So there is a ATP depletion. So what happens after that? There is no cellular respiration. There is no functioning of electron transport chain. So because of that, no ATP. So what happens? Actin and myosin. So you must be knowing in physiology, actin and myosin cross bridging. For separation of actin and myosin, we need ATP. When ATP is not there, so actin and myosin cross bridging persists. Because of that, there will be stiffening and shortening. So what happens? Because of ATP depletion, so there is a cross bridging between actin and myosin. You must be knowing thick filament, that is the myosin, thin filament, that is the actin. So sarcomere basically. Okay. So the mechanism is ATP depletion. When there is no ATP, there is no separation of actin from the myosin. Actin from the myosin head. So muscles will be in the contracted state. So this is the mechanism of rigor mortis. Okay, rigor mortis. So everybody write one word, ATP depletion, in the chat box. ATP depletion you write in the chat box. Okay. So look at this. This you need to write in the exam. So after death, what happens? There will be cessation of circulation. Oxygen supply fails. Respiration ceases. That means cellular respiration that ceases. There will be more and more glycolysis. So glycolysis, glycogen converts into lactic acid. So there will be more and more lactic acid at the cell level. So there will be onset of rigor mortis. So remember, rigor mortis is also known as acid rigor. Acid rigor. Okay, acid rigor. Alkaline rigor, that is nothing but the cataleptic rigidity or cadaveric spasm. So remember, respiration ceases, ATP depletion occurs, no separation of actin and myosin. So that leads to rigor mortis. So what happens later? So loss of structural integrity of proteins, denaturation of proteins, and autolysis. So autolysis means decomposition. So decomposition of putrefaction. So there is a release of proteases and catepsin. So they are going to denature the protein. They are going to separate the actin from the myosin. So that leads to release of calcium. Passing of rigor mortis. So this is very, very important table. Very, very important flow chart you need to write in the exam. Mechanism of rigor mortis. Okay guys, have you understood this? Yes guys, have you understood? Arshad, R, Surya, mechanism. I'll repeat again. After death, oxygen supply fails. Because of failure of oxygen entry into the cell, respiration stops. Cellular respiration stops. No ATP synthesis. When there is no ATP synthesis, so muscles will be in the contracted state, no separation of actin from the myosin. But once degradation or once putrefaction starts, release of proteases, cathepsins, hyaluronidase, elastase, all enzymes, they are going to denature the muscle protein, release of calcium, there will be this appearance of rigor mortis. So this is the mechanism of rigor mortis. You need to write in the exam. Yes, Arshad, Surya are very good. Fine. So this is the diagram you can see here. So in exam you need to write some diagrams also in forensic medicine. One diagram you can write. This is the very beautiful diagram showing muscle contraction. So you can see here muscle contraction. So this is the muscle contraction and this is the muscle relaxation. And also see here sarcomere, which is the functional unit of the muscle. We can see a thick filament, that is the myosin filament, thin filament, that is the actin filament. So what happens actually, so all the muscle, they undergo contraction after death by utilizing ATP that is present in the plasma. So but for separation we need ATP. There is no ATP, muscles will be in the contracted state, that is known as rigor mortis. Rigor mortis. So this diagram you need to write to get good mark in your prof exam. Yes, Arshad, it is also can be released by mechanical force, that is known as breaking of rigor mortis. So that is by mechanical force. Okay, good point. Who answered? Arshad answered. He said, sir, it is also can be released by mechanical force, that is known as breaking of rigor mortis. Okay, yes. Now next question, all of you. What is the first muscle? What is the first muscle in which rigor mortis starts? Anybody? What is the first muscle? Voluntary or involuntary, any muscle. In which muscle the rigor mortis is going to start? Anybody can answer? Anyone guys? Anyone? Rigor mortis now appearance, how it is going to appear, how it is going to disappear. That is also a very important question in exam, viva, prof exam they can ask. The rule is known as Nysten rule. Nysten rule of order of appearance of rigor mortis. Muscles of eyelid, I think Arshad answered. Arshad, very good. You said eyelids. Eyelid is the first voluntary muscle. First voluntary muscle. Very good. Hinish Patel answered, sir, heart. Very good. Heart is the first muscle. Very good. So answer is heart finally. So heart is the first muscle, so which undergo rigor mortis. Heart. So within 1 hour after death. 1 hour after death. So heart is the first muscle. Okay. So the heart muscle undergo contraction. So there will be stiffness that can be noted during post-mortem examination. Sometimes it can be confused with left ventricular hypertrophy. So this can be asked in your MCQ. So what is the condition that resemble like LVH during post-mortem examination? Your answer should be that is the rigor mortis. Rigor mortis is the shortening and stiffening of the muscle that can be confused with LVH. Okay, yes, that is the first muscle. Second muscle, eyelids, 3 to 4 hours. Neck and lower jaw, face, 4 to 5 hours. So first neck, then lower jaw, then face. Then chest, 5 to 7 hours. Upper limbs, 7 to 9 hours. Abdomen and uterus later. Lower limb 9 to 11 hours. 9 to 11 hours. Fingers and toes 11 to 12 hours. So you can see here. So this is the standard progression of rigor mortis. So this rule is known as Nysten rule. Okay. So try to understand. Nysten rule can be asked. Can be a 3 marks question. Nysten law. 3 marks question. So Nysten law is the rule of appearance of rigor mortis. So that is a very peculiar appearance. The first heart, then eyelids, then leg, lower jaw, face, chest, upper limb, abdomen and uterus, and lower limb, fingers and toes. And remember, very interesting, it disappears in the same order. It disappears in same order. So this is Nysten law. So there is one more rule, try to memorize, Shapiro rule. Shapiro rule. Shapiro rule is proximo-distal progression. Proximo-distal progression. So the proximal muscle, they undergo rigor mortis in the beginning. Distal muscle, small muscles, they undergo, distal muscle basically, they undergo the rigor mortis. So proximo-distal progression is Shapiro rule. Nysten rule is already we discussed. There is one more rule, rule of 12. Rule of 12. Anybody, what is rule of 12? Can you answer this? This is very, very important question. Rule of 12, 3 marks question. What is rule of 12 in relation with rigor mortis? Anybody? Can anyone answer? Anyone, guys? What is rule of 12? There are so many rules in medicine. Rule of 10, rule of 2, rule of 12. So rule of 10 for pheochromocytoma, rule of 2 for Meckel's diverticulum. My question is rule of 12. What is that in relation with rigor mortis? Chalo, anybody? Arshad, Henish Patel, Surya can answer this question. What is rule of 12? What is rule of 12? Okay, very good. Arshad answered, sir, it develops in 12 hours. So it develops completely in 12 hours. Maintained for 12 hours. So it develops in 12 hours, maintained for 12 hours, disappears in 12 hours. So the simple rule it is. So rigor mortis completely develops in 12 hours after death. Maintained for 12 hours, disappears in 12 hours. So the simple rule, that is the rule of 12 relation with rigor mortis. Very good, very good. Good, very good, Arshad. Good. Now I am going to ask you guys, does rigor mortis occur in paralyzed limb? Does rigor mortis, that is the post-mortem change, stiffening and shortening, does it occur in paralyzed limb, like example polio? Anybody say yes or no? Arshad, anybody? Paralyzed limb, maybe due to stroke or polio or any paralytic condition. So muscle is paralyzed. So what do you think? Does it occur in paralyzed limb or not? Arshad? Yes, Arshad, come on. Yes, guys, anybody? Yes or no? Very good, yes. Your answer should be yes. So rigor mortis has no relation with nerve supply. Okay, it has no relation with nerve supply. It occurs in all the muscles. Paralyzed muscles, voluntary muscle, involuntary muscle, cardiac muscle, all the muscles. It has no relationship with the neural regulation. Okay, very good. Next, rigor mortis can occur in any muscle. It can occur in dartos muscle also. Dartos muscle. So dartos is a small muscle, so that covers around the scrotum. It's a layer of scrotum. Anybody, what happens after death when there is a contraction of dartos muscle after death? What would be the finding at the crime scene or during examination of dead body? Anybody? Dartos muscle contraction. So there will be a finding. Like uterus contraction, there can be post-mortem delivery, or because of relaxation of all the sphincters, So there can be post-mortem delivery or because of contraction of the uterine muscle. Same way, dartos muscle contraction. So what would be the finding during examination? So because of this, so there will be seminal stain. So there can be seminal stain at the tip of the penis, probably because of the contraction of dartos muscle. Okay, fine. Now one more question, guys. Say example, fetus less than 7 months. Does it occur? Rigor mortis? Anybody? Fetus less than 7 months. Fetus less than 7 months. 7 months means viability, guys. So in forensic medicine, viability in India, that is 7 months. So consider a fetus who died. So the age of the fetus less than 7 months. My question is, does it occur or not? Yes or no? Yes or no? So the answer is no. So rigor mortis is absent in fetus less than 7 months. So this is given in standard textbook. Okay, rigor mortis absent in fetus less than 7 months. So this is what you need to write in the exam. Chalo. Okay, good point, Arshad and R. Good. So this is the appearance we are discussing, guys. Look at the animation. Very beautiful animation you can see here. Eyelids 3 to 4 hours, then neck, then it goes lower jaw and the muscles of the face, then chest, upper limbs, then abdomen, then lower limbs, then fingers and toes. So this is the appearance of rigor mortis. So have understood, guys? Have understood this? Have understood? This is Nysten rule. Say yes or no in the chat box. Yes or no in the chat box, guys. Yes. Appearance. Look at this animation. Okay. So same way it disappears. So rigor mortis disappears in the same order in which it appeared. Okay. Next, early onset and passes of early. So early onset. So normally rigor mortis appears in 2 to 6 hours, but in some condition it appears early. So within half an hour it appears and it passes off early. So it will not persist more than 12 hours. So early onset, passes of early. What is the condition? Anybody? Any one condition? Early onset of rigor mortis. So this can be asked in your exam, guys. Early onset, late onset. 1 mark question. So basically a 3 marks question where early onset can be asked and also late onset also can be asked. Anybody can answer? Early onset. Early onset probably because of early depletion of ATP. So whatever condition where early depletion of ATP or any condition utilizing ATP before that. Yes, what is that condition? Anyone? Anyone? So the answer is electrocution. Electrocution. So what happens in electrocution? There will be muscle contraction. So there will be muscle contraction. So because of muscle contraction, what happens? So ATP is utilized. So ATP depletion is high. So ATP depletion is high. That's why. Then cancer. Cancer is a condition where there is atrophy of muscles. Convulsions, muscle contraction again. Hot environment. So in all these conditions, early onset do occur. The question can be asked late onset or delayed onset. So delayed onset, that is probably because of late depletion of ATP. So what are the condition? Asphyxia is a one condition, delayed onset. Cold environment, hypothermia, all these are the condition, delayed onset. So early onset is electrocution, late onset is cold environment and hypothermia. Okay. Sometime this can be asked. Rapid onset but stays for longer time. Your answer should be two conditions. One is cyanide poisoning and second one is strychnine poisoning. Cyanide and strychnine both are the causes of rapid onset of rigor mortis. Strychnine and hydrocyanic acid, cyanide poisoning. Yes. So let me ask you one more question here, guys. One very commonly asked question in your prof exam. Treatment of cyanide poisoning. Anybody? Treatment of cyanide poisoning. 3 drugs used in case of cyanide poisoning. Can answer this? Anyone? Treatment of cyanide poisoning. 3 marks question. So let me discuss one more question here. Treatment of cyanide poisoning. It is very commonly asked in toxicology. So in toxicology around 25 marks do come. So out of 100 mark toxicology carry 25 marks. So what is the treatment of cyanide poisoning? Arshad Sham R and Mr. Henish Patel can answer this. Aryl nitrate, very hydroxycobalamin, fine. Yes, very good. Amyl nitrate, guys. Amyl nitrate. Sodium nitrate. And one more is sodium thiosulfate. So remember 3 drugs. Very commonly asked 3 marks question. So treatment of cyanide poisoning. Your answer should be, sir, amyl nitrate given inhalationally. Sodium nitrate, sodium thiosulfate given intravenously through the same needle, same cannula. Same cannula it is. Okay. Cyanide is a ideal suicidal, ideal homicidal. So that's why it is very commonly asked. Cyanide causes histotoxic anoxia. It causes brick red postmortem hypostasis. So cyanide can be used in homicide. Cyanide also lead to accidental death. Like example, Bhopal gas tragedy. So yes, this can be asked in your exam. Yes, Adnan Khan, Imran. Yes, beta. Forensic medicine is there for every stream. So this can be asked, guys. Next. Now I'll show you one more picture, guys. Look at this picture. Very nice picture. So the picture showing a fruit and also showing seeds. What are these seeds? Anybody? What are these seeds? Come on, guys. What are these seeds? Very poisonous seeds. Looks like banana chips. Very small, circular, concave, convex seeds. Very poisonous. One seed can lead to death, which causes tetanus-like symptom. Rhizus, sardonicus, opisthotonus, pleurostotonus, and all. What is this seed? Anybody can identify? Identify, guys. Very good. So beta, very good. It is Nux vomica. So Nux vomica can be a 3 marks question. 3 marks question. Okay. So go through this. One more important topic in your toxicology. Nux vomica, strychnine poisoning, spinal poison which acts on spinal cord, inhibits glycine, causes sustained muscle contraction. So that is your Nux vomica. One seed can lead to death. So and treatment is short acting barbiturate and symptomatic. Cause of death is respiratory paralysis. So we do Wenzel test and other tests in case of strychnine poisoning. Yes, Nux vomica, many answered. That's really nice. Fine. Now come back to the question now. So rigor mortis now. Medico-legal importance of rigor mortis. Medico-legal importance of rigor mortis. Anybody? Rigor mortis, what is the medico-legal importance? So anybody can answer this? Anyone? Let's make it interactive, guys. Adnan Khan, Hanish Patel. So what is the medico-legal importance of rigor mortis? It can be 3 marks question. It can be a part of main question. Yes. Come on. So rigor mortis means shortening and stiffening of muscles after death. We said rule of 12. So what is that? So remember, it is the sign of death. Sign of molecular death. When you see rigor mortis, that means it is a molecular death. So that is a sign of molecular death. Time since death can be established. Time since death. Say example, entire body is rigid. Say example, entire body rigid. Entire body is rigid. What is the time since death? Anybody? What is the time since death? Entire body rigid. So when I go to a post-mortem room, autopsy room, when I examine the dead body, so rigor mortis is there everywhere. It is there in the eyelids, it is there in the hand, it is there in the fingers, it is there in the proximal muscle, deltoid, triceps, neck muscle, thigh muscle. All the muscles, they are showing rigidity. So what is the time since death, guys? Anybody? Time since death? What do you think? Time since death means number of hours elapsed between death and post-mortem examination. Okay, death and post-mortem examination, the interval is known as time since death. Yes, guys, entire body is rigid, all the muscles are rigid. What would be the time since death in this particular condition? Very simple, guys. I'm not asking you PG level question, I'm asking you a very basic question. Yes, Adnan. Okay, okay, Arshad, you were right. Position of body at the time of death. Okay, good. So by looking at the rigor mortis, you can guess about the position of body in which the body is kept after death. Very good point. Good. Whether supine position, prone position. Looking at the rigor mortis appearance, you can tell about the position in which the body is kept. Okay. Now come back to the question, guys. During postmortem examination, timing of, okay, you said timing of death, that is also fine. Entire body is rigid. What is the time since death? How many hours? So options are 6 hours, more than 12 hours, 3 hours, 1 hour. What is the best answer, guys? What is the best answer for this question? Entire body is rigid. Yes, now you try to answer, guys. Try to answer this. Okay, time since death can be established. Okay, so when entire body is rigid, it is more than 12 hours. So and when entire body relaxed, when there is a second relaxation, probably it is more than 36 hours. 36 hours. Arshad, very good. 12 hours is the correct answer. Good. So time since death can be established. Position of body also can be established at the time of death. So sometime it is confused with cadaveric spasm, heat stiffening, cold stiffening, gas stiffening and all. That also you can write in exam. Okay, 4 points. Fifth point, breaking of rigor mortis. So by applying mechanical force. So while handling or when mechanical force is, when you use mechanical force, there can be breaking of rigor mortis. That also you can write in the exam. Then lastly, it can occur in paralyzed limb also. It can occur in paralyzed limb also. So you need to write like this: 1, 2, 3, 4, 5, like this. So point wise answer. You need to answer in a point wise manner. Okay. So first is the definition. You need to write a beautiful definition of rigor mortis. Then you can write a picture of sarcomere and all. You can tell about the. You can write about the mechanism of rigor mortis. Then you can write a picture of human body. You can show a Nysten rule of rigor mortis. Okay. Then you can tell about the disappearance, rule of 12, Shaffer rule. You can explain. Then you can explain about medico-legal importance of rigor mortis, and also you can explain some more about time since death. When entire body rigid more than 12 hours, when entire body relaxed, when there is second relaxation, there can be more than 36 hours. So this is how you should answer, Arshad. Okay, this is how you should answer in your paper. Yes, guys, have you understood this prof question? Say yes or no, guys. Yes or no. Now we are discussing about differential diagnosis. Next heading, differential diagnosis, DD. Differential diagnosis, not Duradarshana, DD it is. Differential diagnosis of rigor mortis. There are 4 conditions. 1, 2, 3, 4. Yes. What are the four conditions resemble like rigor mortis? So the first one is cadaveric spasm. Cadaveric spasm. Cadaveric spasm. So what happens? Cadaveric spasm is antemortem phenomena. So it is the contraction of muscles, especially the muscles of the limb or muscles of the forearm or the hand. So antemortem phenomena. So that can resemble like rigor mortis. So like example, in case of drowning, when there is a cadaveric spasm with aquatic matter in the hand, so that is antemortem phenomena. Sometimes there can be confusion between cadaveric spasm and rigor mortis. Remember, cadaveric spasm is an antemortem phenomena, so that occurs before death. That shows the manner of death. So in cadaveric spasm, remember, it is also known as instantaneous rigor. Instantaneous rigor. Okay, that can be differential diagnosis. Then there can be a condition known as heat stiffening. Heat stiffening. See, when especially in case of bone injury, antemortem or postmortem bone injury, so when muscle exposed to some degree of heat, more than 65 or more than 70, all the muscle undergo denaturation. When they undergo denaturation, so there will be an attitude known as pugilistic attitude, boxing attitude, that is known as heat stiffening. That can be a question in your exam. Heat stiffening. Then it can be cold stiffening. Again, because of extreme degree of cold, all the muscle undergo stiffening, that is cold stiffening, that occur in extreme degree of temperature, like example minus degree temperature. Or one more condition resemble like this is a gas stiffening. Gas stiffening. So there are four conditions resemble like rigor mortis: cadaveric spasm, heat stiffening, cold stiffening, and gas stiffening. Gas stiffening because of the putrefaction. Putrefacted gases that leads to stiffening of the muscle and joint. Yes. Now look at this, guys. How have you identify what is this condition? Now let's make it interactive, guys. What is this condition that resemble like rigor mortis or differential diagnosis of rigor mortis? In a case of drowning, you can see aquatic matter in the hand, aquatic matter, aquatic plants in the hand. So what is this condition known as? You need to identify, guys. You need to identify. Yes, what is this? What is this? This is cadaveric spasm. Very good. So this is your cadaveric spasm. Cadaveric spasm. Very good. And what you can see the plants, and also you can see the mud. So it's a case of drowning. So it is a case of drowning. It shows that the person was alive at the time of drowning. So it's an antemortem phenomena. Okay, try to understand. This is an antemortem phenomena. It's an antemortem phenomena. Yes, antemortem phenomena. It is also known as cataleptic rigidity. Cataleptic rigidity. It shows the manner of death. It shows manner of death. Like in case of drowning, firearm injury, okay, bone injury. So manner of death. When you see the pH of the muscle, is alkaline. Okay. So if you know this 4 or 5 points, that is more than sufficient. So 3 marks question can be asked. Cadaveric spasm, 3 marks. So cadaveric spasm is a contraction of voluntary muscle. So especially the muscles of the hand and the limbs, which is antemortem phenomena that shows the manner of death. Remember, it occurs only in the voluntary muscle. Only in the voluntary muscle. Okay. So this is what you need to understand. Cadaveric spasm, very good. Karma gaming, Muhammad Yahya, very good. Muhammad Yahya, very good point, very good Very good. So 3 marks question. This is about the cadaveric spasm. Next question, guys. What is this condition? What is this condition where there is a boxing attitude? So this is the condition. So occurs in bone injury, ante-mortem or post-mortem bone injury. You can see there is a flexion at the wrist. So also flexion at the elbow, abduction at the shoulder joint because of denaturation of protein. A case of bone injury. What is this known as? A differential diagnosis now. Karma, Muhammad Yahya. What is this? What is this appearance? Mike Tyson appearance. Mike Tyson, Muhammad Ali appearance. Come on, guys. What is the answer? So this is your heat stiffening. Heat stiffening. Heat stiffening. Okay. So it is can be ante-mortem or it can be post-mortem. Ante-mortem or post-mortem. So when body exposed to more than 65 degrees Celsius, bone injury. So muscle protein undergo denaturation. So this is about the heat or hot stiffness. Very good. Next. Look at this now. This is the cold stiffening. Cold stiffening. Cold stiffening. So when body exposed to extreme degree of cold, muscle undergo denaturation. So upon heating, so there can be normal appearance of the rigor mortis. Okay. Next. So this is about the main question we discussed. So I'll repeat again. I'll just summarize all the points what you need to write in the exam. So this is the question asked in your exam. Explain the mechanism, order of appearance, causes of early onset and late onset, and medico-legal importance of rigor mortis. 10 marks question in your exam. So what you need to write? Definition you need to write. So rigor mortis is the early post-mortem change characterized by shortening and stiffening of muscles after death that follows the period of primary flaccidity. So the main mechanism is ATP depletion. Then you need to write this flow chart and also this mechanism of actin and myosin separation and rigor mortis. Then you need to explain about the Nysten rule. So Nysten rule, according to Nysten rule, so it has a standard appearance. So heart, eyelids, neck, finally into the fingers and toes. Other rules we can write Shapiro rule and rule of 12. So it can occur in paralyzed limb. So it do not occur in fetus less than 7 months. Then you need to write about the early onset of rigor mortis. The causes are electrocution, cancer, convulsion and hot environment. Late onset or delayed onset, example asphyxia, cold environment. Rapid onset occur in strychnine poison and hydrocyanic poison. Cyanide poison, we discussed on extra point. There are 3 drugs used: amyl nitrate, sodium nitrite and sodium thiosulfate. So then you need to write about the medico-legal importance, guys. So what are the medico-legal importance? Sign of molecular death, time since death can be established, position can be established. Sometimes it is confused with cadaveric spasm, breaking of rigor mortis because of the manual handling of the dead body. So it can occur in paralyzed limb. Differential diagnosis, there are 4 conditions: cadaveric spasm, heat stiffening, cold stiffening and a gas stiffening. So if you write this, more than sufficient for your main question, that is 10 mark question. Yes. So Muhammad Yahya, understood all this? Understood, guys? Just say yes or no. Yes or no, guys. Yes or no. I'm just waiting everybody in the chat box. Yes, okay. Now we are discussing some one more question about one more very important question. What are the changes in putrefaction? 5 marks question. Putrefaction can be asked. Okay. So putrefaction. So before that, there are some late postmortem changes. What are late postmortem changes? Anybody? What are late postmortem changes? Can anybody answer this? 3 marks question can be asked. Late postmortem changes. What are late postmortem changes? Anyone? Anyone, guys? So there are 3 late postmortem changes. So they appear usually after 36 hours. Usually starts within 24 hours. So they get established after 1 or 2 days. Late postmortem changes. What are they? So what are they? So one is your putrefaction. Putrefaction. Second one is adipocere. Adipocere. Third one is your mummification. Okay, mummification. So the putrefaction very commonly asks 5 marks question. Okay, it's 5 marks question. Adipocere, one very commonly asked 3 marks question. 3 marks question. Mummification also 3 marks. So this is very, very important. So after the class, you just go through these 3, very, very important. Now I am going to discuss about putrefaction. Putrefaction. Putrefaction we are discussing. So putrefaction means decomposition. Okay, decomposition. So decomposition, dissolution, autolysis. There are many names. Autolysis, disintegration of dead body. So all these are common names given to putrefaction, which is the most common late postmortem change. So I divide putrefaction into external putrefaction and internal putrefaction. So external and internal putrefaction. So what are the external findings in putrefaction? So that comes under external putrefaction. What are the internal findings? The interputrefaction basically. So basically that is a degradation, autolysis basically. So this is how you need to answer. So external putrefaction or putrefaction characterized by 4 Ds. What are they? Dissolution, distension, degradation, discoloration. Okay, discoloration, distension, degradation, and finally skeletonization. So there are 4 Ds of external putrefaction. So all of you try to memorize this. 4 Ds of putrefaction. What are 4 Ds? The 4 Ds are basically, so these are 4 Ds. Try to memorize this. 4 Ds. So 1D, that is the discoloration, distension, degradation, dissolution. So all of you write in the chat box. 4D in the chat box you write. Write this in the chat box, guys. 4Ds is equal to putrefaction. Write this in the chat box. Four Ds. Muhammad Ali. Very good. 4Ds. Discoloration. What type of discoloration? Green discoloration. Why green discoloration? Because of sulf-meth-hemoglobin. Distension. Why distension? Because of the putrefactive gases. Like example, methane, carbon monoxide, carbon dioxide, so many gases. So methane gas, hydrogen sulfide gas and all. Degradation because of the catalytic enzymes. Dissolution because of the, again, catalytic enzymes. So autolysis basically. So 4Ds are external putrefaction. Yes. So point wise you need to answer. What is the first external site of putrefaction? What is the first external site? So anybody can answer. What is the first external site? First external site of putrefaction. Anyone? Anyone, guys? Anyone? first external site of putrefaction? So answer should be, that is right iliac fossa. Right iliac fossa. Right iliac fossa. The first internal site, that should be your aortic intima or under surface of the liver. Under surface of the liver. Under surface of liver. Okay. Let's see what are the important findings in case of putrefaction. I think you can see there is one very important finding in the picture there, guys. You can see prominent veins, the prominent green color veins. So what are these prominent green color veins that is visible over the chest, normally seen over the thighs, or the normally seen over the chest? So root of the neck. Anybody? What is this appearance known as? What is this appearance known as, guys? So this is the appearance visible in external putrefaction. What is this? So let me discuss some more points here. Chest and neck, I think they are okay. So this is known as marbling. So you can write about the marbling. So marbling, that is nothing but your road map appearance. So road map appearance. Road map appearance. Okay. So green color veins over the chest and the thighs. Marbling can be seen. And there can be blisters. So there can be blisters over the abdomen and the thighs. So they are known as post-mortem blisters. Post-mortem blisters. Okay. So all these blisters, all this because of the one very important bacteria, that is because of Clostridium welchi. Clostridium welchi. This Clostridium welchi produces powerful enzymes, like example hyaluronidase, and your lipase, protease. So this welchi leads to green color pigmentation. So green color pigmentation. So the green color pigmentation, that is basically because of the, so it's Yogesh Chapda, yes, Yogesh Chapda. So green color pigmentation in case of putrefaction, what is the compound responsible for green color pigmentation? Anyone in case of putrefaction? What is the compound responsible for green color pigmentation? Anyone? Yogesh and others? Let's see who is going to answer this. Lymph vessels, no, basically they are blood vessels, beta. So they are blood vessels. So because of the pigment, so the green pigment, they looks like roadmap appearance. What is that pigment? Anybody? So your answer should be, anybody? Sulf-methemoglobin. Sulf-methemoglobin. So you need to write point-wise manner. So there can be a marbling, there can be blisters, post-mortem blister. The question can be asked how to differentiate between post-mortem blister and ante-mortem blister. Ante-mortem blister, they consist of albumin or protein. Post-mortem blister, they contain only the gas. Clostridium welchi is the main enzyme. So it multiply in ileocecal junction. It produces powerful enzyme that give rise to green color pigment, that is known as marbling and all. Okay. Then also there is a finding, there can be abdomen. What is the finding over the abdomen in case of external putrefaction? Anybody? What happens in abdomen finding? Muhammad Yahya, Yogesh Chapda. What would be the finding in case of putrefaction after death? That is, abdomen finding. What happens? What happens in uterus, है ना, abdomen, all? So there will be bloated abdomen. Okay, so bloated abdomen, bloated abdomen. So the bloated abdomen because of the gases, the foul smelling gases. So foul smelling gases. So basically methane, hydrogen sulfide and all is because of again Clostridium welchii. There can be something known as post-mortem purging, PM purging. So there can be bleeding. So there can be bleeding from mouth or the ear, that is known as post-mortem purging, which is nothing but an post-mortem artifact. So there are many findings you need to write like this. Okay, the first external site is the right ilia fossa. The first internal site is the aortic intima or the endosurface of liver. So what are the important changes in external putrefaction? The first important finding will be the marbling, which is the roadmap appearance. Second, there can be post-mortem blisters. All is because of the Clostridium welchii and powerful enzymes. Then abdomen can be bloated abdomen because of the gas inside the intestine. So abdomen can be bloated, and body floats in the water. There can be bursting of the abdomen after 3 or 4 days. So uterus also undergo same finding. So they undergo autolysis. There can be post-mortem purging. There can be bleeding from the mouth and the ear. So that can be a post-mortem artifact. Yes. Now, guys, what is the finding here? Anyone can identify in case of external putrefaction. So, what is the finding here? Let's see who is going to answer this. Come on, guys. What is the finding in putrefaction here? What is the finding in putrefaction? Come on. Okay, let's see. So this is the finding. You can see the post-mortem blisters. Hai na? So all these are post-mortem blisters. So it looks brown. Okay, skin looks brown or black. Sometimes it can be green. In advanced putrefaction, it can be black. Okay, because of the ferric sulfide other compound, it looks like brown or black color. Okay, brown or black color. So, and this is what the marbling we discussed already. So marbling we discussed. Marbling. Then you need to write about internal. External putrefaction is over. Then internal putrefaction. Internal putrefaction basically liquefaction of tissues. So all is because of again Clostridium welchii and other enzymes. So liquefaction of tissues begins from trachea. So the first area that is showing is larynx and trachea. So begins from larynx and trachea. Larynx and trachea. Then the first site, that is the larynx and trachea, that occurs in 5 to 10 days. 5 to 10 days. The last site, that is your bone or prostate or non-gravid uterus. Non-gravid uterus. So if they ask you what is the last site of internal putrefaction, the answer should be bone. If bone is not given, prostate, otherwise non-gravid uterus. Liver. So in case of putrefaction, liver shows some characteristic finding. So when you see liver, there will be fat globules like this. You can see in the picture also here. This picture also you can see there are some fat globules inside the liver Can anybody identify what is the finding in the liver in case of internal putrefaction? Yes, anyone? Yogesh Chapda, Muhammad Yahya and others. What is this finding in the liver showing some fat globules like internal putrefaction? Internal putrefaction. Yes, anybody? So this is known as honeycomb liver. Honeycomb liver, also known as Swiss cheese appearance. So Swiss cheese appearance. So that occurs in case of internal putrefaction. So teeth, there can be pink color teeth, pink teeth phenomena. So pink teeth phenomena, that is also because of the internal putrefaction. So because of the base of the teeth, especially base of the teeth, there will be pinkish appearance, that is known as pink teeth phenomena. So that also can be seen. Then there can be post-mortem luminescence. So because of the emission of light from the body after death, that is known as post-mortem luminescence, because of armillaria milia and armillaria milia is the one which leads to this post-mortem luminescence. So all these are the findings in internal putrefaction. So whenever question asked 5 marks question, what are the findings in putrefaction, you need to write about external putrefaction, what are the important findings, then what are the internal putrefaction, what are the findings, especially liver and the teeth, and what is the first area which undergo internal putrefaction, autolysis, that is larynx and trachea. Last area, that is basically your bone, a prostate, an ungraved uterus. So there can be post-mortem luminescence, emission of light from the body after death, okay, because of the armillaria milia. So that is the fungus that leads to this. So this is how you should answer the putrefaction. Yes guys, so this is about the 5 marks question and some more important questions in your topic. So after the class, go through these topics. This topic guys. Post-mortem staining, very commonly asked. So let me write all the important topics. After the class, you go through this from Thanatology. Post-mortem staining. So can be a 5 marks question. It's a 5 marks question. Our question can be from Algar Mortis. So can be a 5 marks question. Algar Mortis means post-mortem cooling. Post-mortem staining means that is the the collection of blood in the dependent area. The one very commonly asked question is post-mortem staining color and the poisoning. Anybody? Cherry red color post-mortem staining, what is the poisoning? Anybody? Cherry red color. So during post-mortem examination, the color of the post-mortem staining is cherry red color. What would be the poisoning in that case? Anybody? Anybody guys? Anyone in the class? Anyone? So Algar Mortis. Sometimes the question can be asked from post-mortem artifact. Post-mortem artifact. 5 marks question. Some more topics like mummification can be a 3 marks question. Mummification. Adipose formation. Adipose can be a 3 marks question. So go through all these important topics, they're very commonly asked. Okay. Rigor mortis we discussed in detail. Cadaveric spasm we discussed in detail. Sometimes the question can be classify post-mortem changes. So classify Post-mortem changes. Embalming can be a 5 marks question. Embalming fluid can be a 3 marks question. Okay. Post-mortem caloricity, a 3 marks question. Three marks. So let's summarize what are the important topics in thanatology. The first one is the classification of postmortem changes. What are early changes, late changes, and immediate changes. Second important topic is rigor mortis. We discussed in detail about it. Postmortem staining you must know, especially the color and the medico-legal importance. Algar mortis, medico-legal importance. Postmortem artifact can be asked. Prinsloo Gordon artifact. So our third party artifact can be asked in your exam. Mummification, one favorite question in your exam. Adipose formation can be 3 marks or 5 marks usually. Then embalming fluid and embalming process can be asked. Postmortem caloricity. So what are the causes of postmortem caloricity? That also can be asked. So that's it about the some important questions in your thanatology. So next topic we are going to discuss about sexual jurisprudence, some important questions in sexual jurisprudence just to help you your upcoming prof exam, third year prof exam. So thank you everybody. If any doubt you can message me in telegram group. So thank you all.